Hello everyone, welcome to Talking with Dr. Laz, your favorite health program on television. Reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, this is the end of 2022. We are in the last quarter of 2022 and President Muhammadu Buhari has presented the budget proposal for 2023. It's right before the National Assembly. National Assembly is on recess and various committees are already going through the budget. And of course, it's expected that budget defense will start any moment from now, and the budget could be possibly passed before the end of the year. And 2023 being an election year is very crucial in terms of setting the agenda, and we keep being interested on healthcare financing. How much is being put for health and how much value do we get from the monies that is being spent? Of course, experts have already said in different fora and different evidences have shown that we are not putting enough resources for health, and at the same time we are not getting sufficient value for what we are spending. So on the program today, I will have development experts who have dedicated significant number of years on analyzing budgets, not only in health but also other sectors, leading advocacy, trying to ensure there is value for money, there is efficiency in utilizing our health budget, and also pointing out certain frivolous expenses that find their way into the budget that are not really giving value to the Nigerian people. I know you can't wait to meet our guests. You stay with us, we'll be right back after this break.
Health Agenda 2023. The Nigerian health system is becoming weaker with the mass exodus of medical doctors, nurses, and other skilled health workers out of the country. In February and March 2023, Nigerians will go to the polls to elect the next president and state governors, respectively. This provides an opportunity for the election of leaders who will help to strengthen the health sector and reposition it to deliver quality healthcare services at all levels. We present to you Health Agenda 2023, an interview segment on this program for presidential and governorship candidates to discuss their health agenda before the electorates. For sponsorship and participation, reach out through any of the contact details displayed on your screen.
Welcome back to Talking with Dr. Laz, your favorite health program on television. We are discussing healthcare financing and of course bringing into focus the 2023 health budget proposal, the utilization of health budget over the years, and of course to make recommendations to policymakers, both the outgoing and the incoming ones from 2023. And with me to discuss this is Eze Onyekwere. He's a legal practitioner and a development expert who has dedicated a lot of years in scrutinizing health budgets and doing research on their utilization. Welcome once more to the program, sir.
My pleasure.
Thank you. In 2023 health budget proposal, President Muhammadu Buhari proposed over 1 trillion naira. In naira value, this is said to be the highest ever. Of course, if you put the exchange rate into consideration, the data may be different. But 1 trillion 97 billion 703 million 830,504 naira was proposed for health budget, and this is about 5.35% of the total budget, far below like a third of the Abuja Declaration recommendation of 15% made in 2001. Looking at this, what's your first impression looking at the entire budget proposal as well as the clamor and the advocacy over the years for increased funding for budget for health?
It doesn't show strong political will for health, because the expectation is that with Nigeria's very poor health indicators, that the government should have prioritized health care. I mean, we are discussing the Abuja Declaration of 15%. Now, 1/3 of that is about 5%, which is what the government had done. That's not a pass mark. I had expected that as a minimum that the government should have come up with at least 50% of that benchmark, which is like 7.5% of the budget, the expenditure, being dedicated to the health sector. If you start with 7.5% and you are pleading, oh, we don't have resources, we have other things to do, it becomes more commonsensical. But to pledge 15 and to deliver 5 is not the way forward. It's not the way to go. Although we looked at the budget to see if there are other expenditure relating to healthcare. When we saw some of the votes in the service-wide votes, the money going to immunization and Gavi, the little money going to retirees, the military retirees, their National Health Insurance Fund, as well as the 5 billion proposed for the insurance of youth corpers. It only came up to about 5.7. Okay, so not really much changed. So in essence, my first reaction is that we are not serious considering the magnitude of the health challenges we face in the country.
But the Federal Ministry of Finance, Budget and Planning had argued that the money for health is not only domiciled in the Federal Ministry of Health, that some resources going into the environment also has health implication. Some that are going into works also are health related. Some are going into agriculture, also has certain relationship with health. So that's the pushback they normally give when we make this analysis. What do you say to that?
Let's put it this way. That's being clever by half. Now, why do I say so? The money for education and for agriculture and for roads could also be found in other ministries. So you don't use those little things that are falling here and there to benchmark. I was also looking at the food for agriculture. Right. They had a number of feeder and rural roads to construct. Ideally, if you are discussing roads, you should think it should be in the Ministry of Works and Housing. So will that now be used to say, oh, the vote of the Ministry of Works and Housing has increased? Okay. There are also education components even in the Ministry of Health, in all ministries. So I think we should focus more on those clear-cut and well-planned expenditure at the mother ministry, which is in charge of policy formulation and to a great extent oversees policy implementation. So the idea that, oh, there are a few millions of naira here and there is neither here nor there. And if the Minister of Finance is serious, they should take time and disaggregate them, pull them all out and show us what it amounts to at the end of the day so that we can have a better understanding. They shouldn't simply ask us to go in and start looking for a needle in a haystack. We are not going to do that. That's their duty. If they want to prove that is beyond 5%, oh, we are doing 10, they should pull it out. They are the ones who compile it. They have the soft copies. So it's even easy to set search engines and pull them all out. That's not for me, and that shouldn't be for you.
Okay, thanks for that point. But there's also an argument again that the Federal Ministry of Health doesn't utilize the allocated funds very efficiently. The Basic Healthcare Provision Funds was first appropriated for in 2018. Just 50% of that was disbursed. But there were a lot of issues around implementation. You know, there are reports that Ministry of Health return funds at the end of the year and all of that. There are issues around absorptive capacity, you know, and value for money. So will it be proper for the federal government to keep pushing more funds when the ones they are pushing to the Federal Ministry of Health, they are not really seeing as much value or even prudent utilization in some cases?
Let's put it this way. The president is the chief executive of Nigeria, right? All the ministers are supposed to be assisting him take up several different ministries, departments, and agencies of government. Now, if you appoint a minister of health in a critical situation like we have, where we still have high maternal and child deaths, where we still have a lot of, vaccine preventable diseases, where we still have basic health care, we've not taken care of them, even though there are little resources. If the minister is not delivering, or the permanent secretary, what do? You take the appropriate sanction. So these apologies will not work. because the challenges are enormous. People are dying on a daily basis. So what should have been done is that there should be collaboration from the top. Mr. President should supervise that ministry appropriately. And if the minister is not delivering, if the PAMSEC is not delivering, they should go. Because you can't use your lethargy to sit over the life of millions of people. Because we are not discussing just some frivolities. We are discussing matters of life and death. And once somebody is gone, you have no capacity to bring him back. So that's why I'm saying the excuse that the ministry is returning money is just because of failure of supervision. Because if I am going to be president tomorrow and that happens, I will tell the minister, no, you can't do this. You either give me a very good reason why this happened, or I'll ask you to leave. Because some of these things, some of them may relate to procurement. There's no big deal about procurement. Like now, they have put up the proposals for next year's expenditure. As soon as the budget is passed and the president signs it in December, early January you can do all your procurement. Now, you don't need to wait until you have the money before you begin to do the procurement. You can advertise, examine bids, open them, examine them, and discover or find out who actually won the bid. You don't need to go and tell the person who have won or the company. Keep it. As soon as money is released, you simply start. You don't have to go back and start doing the advertisement and selection of bids, evaluation, which will take you the next 6 weeks or 3 months before you now, they say, bring back money to treasury. So there is no rocket science about using funds instead of returning them. It's simply the tardiness of the key officials of the ministry. Otherwise, if they know what to do, this shouldn't happen. Even if you release money 2-3 weeks before the end of the year, if you have done your background works very well, you can still utilize a good part of it.
Okay, that's good. Now you mentioned about maternal and child health and why we're not, how badly we are performing in that regard. And that brings me to the Basic Healthcare Provision Fund, which was, Section 11 of the National Health Act 2014 made provision for that. There's been a lot of concerns that even though implementation has begun, Nigerians are not yet getting the value for those resources in a lot of places. Then now coming to that fund, about 47 billion naira is proposed for 2023 budget proposal. So based on your findings so far, what are the key things you want to happen? What changes are you looking forward to seeing at the federal level as well as at the state level where this implementation is actually taking place?
Well, the first thing is that the Basic Healthcare Provision Fund of about 47 billion was put in the budget of the Ministry of Health. It was not treated as a statutory transfer or a constitutional expenditure charged on the Consolidated Revenue Fund, which it should be. And the implication is that if there's paucity of funds, it may or it may not be released. It should be in the same category that like money going to National Assembly, money going to Human Rights Commission, Public Complex Commission, so that it must be fully released. That's the first point. Now, the windows. The window that comes through the National Health Insurance Authority, the one that comes through the National Primary Health Care, the two key windows that get down to the states. So it's not at the federal, the challenge is not at the federal level alone, because we have a situation where states must collaborate effectively, bring in their counterpart funding, reorganize their primary healthcare facilities in such a way that they qualify to access the fund, and actually disburse whatever comes in, set up committees at the ward level so that at the end of the day, and of course raise awareness and sensitize the people that this service is available so that the people can begin to, access these services. I mean, there's a report that was written last year or earlier in the year by one campaign and a number of other groups. One could see the challenges that were inherent in the system, because not all states have been able to activate the mechanisms to allow them to begin to ask their citizens to access these funds. So that's also a question of political prioritization, the political agenda of the respective governors. So it's not just about what happens at the federal level alone, it's also about what is happening at the state level. And some of us have seen that, unlike Quebec, UBEC has this website where they publish what should be due to State A and State B, and what State A and State B has assessed. So you can always discover what your governor and his health commissioner is doing. As of today, the Basic Healthcare Provision Fund doesn't have any such portal or electronic portal, which should have been the case. So one is expecting to have that portal.
Who is supposed to create that portal?
Now, this portal, the National Health Insurance Authority should create a portal relating to the insurance
50%.
gateway. The Primary Healthcare Development Agency should create its own. But I suppose that the best thing is to have one portal domiciled in a collaborative environment where all those who get these percentages, including NCDC and then the emergency fund, should come together and have one portal, so that you don't need to be going from website to website, so that at a click you have a comprehensive set of information relating to the Basic Healthcare Provision Fund.
Yeah.
So we don't have it as at now, which is what's creating problem. And I'm expecting that part of the reforms will be that the state governments should also have their own portal where they publish what actually they agree with the federal government agencies that we have gotten this, and these are the accredited primary healthcare facilities,
and how much goes to them,
and how much is coming to them every week or every month or every quarter. Publish them so that people can know where to access service. So it also gives people opportunity to complain if they go there and the service is not available, or if you say you have rehabilitated this is accessing service, and then when people go there it's not available, then the system can be engaged. But there is no such information. It's still like a hush arrangement. So this is what is needed to throw the gates open, so that civil society, the people in the village, not just the CSOs or people who talk big English like you, the real people who should benefit from this are in the best place to say, no, this service is not available. These people are not telling the truth. So that's the way forward.
That's really a good way forward. I think I need to throw more light on that. It's essentially talking about transparency in the use of these funds, so that citizens will be able to participate. And I think perhaps the Department of Planning, Research and Statistics of the both federal and state ministry of health should be able to at least play this role as a department in the parent ministry, putting out these numbers, or Department of Finance, as the case may be, so that we'll be able to follow through. So far, it's been a very insightful conversation with Mr. Onyekpere on the Health Budget Proposal 2023 and how Nigeria can get more value for money and perhaps more money for health. I know you can't wait to watch the conclusive part of the conversation, but that's going to be next week. Keep watching as we bring to you Health Agenda 2023.
Health Agenda 2023. The Nigerian health system is becoming weaker with the mass exodus of medical doctors, nurses, and other skilled health workers out of the country. In February and March 2023, Nigerians will go to the polls to elect the next president and state governors, respectively. This provides an opportunity for the election of leaders who will help to strengthen the health sector and reposition it to deliver quality healthcare services at all levels. We present to you Health Agenda 2023, an interview segment on this program for presidential and governorship candidates to discuss their health agenda before the electorates. For sponsorship and participation, reach out through any of the contact details displayed on your screen.
Yes, Health Agenda 2023, we keep bringing to you issues that should be topical and governors or governorship candidates in 2023, and of course other political party candidates in various positions, what they need to pay attention to. And with me here is Eze Onyekpere. He's a legal practitioner and a development expert. He's going to share his thoughts because he's led implementation of a number of development projects in the health sector and beyond. Welcome to Health Agenda 2023, Mr. Onyekpere.
My pleasure.
Thank you, sir. You've done a number of work at the national and state level, looking at health budgets, looking at implementation of basic healthcare provision fund, promoting social justice within the health sector. As we move into the 2023 election, what are those issues you want the governorship candidates to pay attention to, as many of them are beginning to roll out their manifestos and launching their campaign towards the March 11, 2023 governorship elections?
If the governorship candidates have the presence of mind, I would have recommended that they take a good look and read the National Health Policy, first of all, and understand it properly. And when they do, they should also read the National Health Act and probably the National Health Insurance Authority Act. By the time they read these three pieces of legislation and the policy, they will have been in a position to understand what the health sector at their state level requires. But in a nutshell, I would think that there are certain critical concerns at the state level. The first is the traditional thing we say about more money for health. And the second is the value for money issues around strategic purchasing. And the most important and third part of it is about the equitable nature of the spending of the health funds. So we are looking at making more money available, spending it in a value for money manner, and then spending it in an equitable manner that you ensure you cover all your citizens. And this brings me immediately to the issue of the recently signed into law National Health Insurance Authority Act. But under that act and under developments in health insurance going on in Nigeria, each state of the federation is required to set up its own health insurance or contributory scheme. And indeed, I understand close to 30 states have done so. And that is what, in the first place, qualifies the states to participate in the resources that are coming through the health insurance window of the Basic Healthcare Provision Fund. So I expect them to set up health insurance agencies, make them functional, because in most states of the federation, these laws are there, but they have not been operationalized. And operationalizing it means also that they should look out for what is called the equity fund. Most of these laws have equity funds, and that's the fund that will, from where you get resources to take care of the poorest of the poor, who may not be able to pay premiums. So in that equity fund, the state government is supposed to give some form of a matching grant, the initial money that sets up that equity fund. And in some states, they are saying even that their elected and appointed political office holders, like in Sokoto, are supposed to contribute 10% of their basic monthly salary into the fund. So in essence, what I'm saying is that they should look at these three key components as well as their health insurance laws, how to implement them.
Okay, thank you very much. This is just a tip of the iceberg. So we're going to have further conversation on this. Thanks for being on Health Agenda 2023.
Thank you.
Thanks for watching up to this point. The essence of all of this is to draw attention on the need for us to put more health first, especially as the next election comes up, and also governance continues after the next set of leaders come in. And at the same time, getting value for money, using the available resources. Of course, we know that resources are scarce, but the available ones, let's get maximum values for it. It's shameful that fiscal responsibility index that the Federal Ministry of Health is not performing very well in that regard. And of course, the Cancer Health Fund is just one of the examples. We've talked about it on this show before. Over R1 billion that is appropriated, and significant amounts of that released to support Nigerians who are struggling to manage their cancer cases. But they go through a lot of bureaucracy and inconveniencing situations to be able to access those funds. And still, despite demands by advocates and interested civil society organizations and citizens, there is still a lot of opacity on how those funds are being utilized. Thanks for watching. My name is Dr. Lars Eze. See you same station, same time next week.